morning, good afternoon, or good evening, depending on where you are in the world. First, a very big thank you to our audience who is joining us for the first of the IMF's seminars for the 2021 annual meetings. And the theme today is promoting resilient recovery for the most vulnerable communities. I want to extend a particularly warm welcome to our distinguished guest, Mr. Antonio Guterres, United Nations Secretary General, who will deliver the first keynote address for these annual meetings. And our panelists for the discussion that will follow, Dr. Jibril, Minister of Finance and Economic Planning of Sudan, Ms. Rindra Hasimbelo Rabarini Rina Rison, Minister of Finance of Madagascar, and Mr. Peter Maurer, President of the International Committee of the Red Cross. We start with the issue of fragile and conflict-affected states because they have been most severely impacted by this crisis. It is near and dear to all of our hearts for those who are working at the front line as policymakers or international institution staff dedicated to partnering with the most vulnerable countries and the most vulnerable communities. Before I turn the floor to Antonio, let me share a few reflections on why this issue is so incredibly important for the IMF and for the international community at this moment in time. The COVID-19 pandemic has been a powerful reminder that countries, like people, need strong immune systems. For countries, their immune systems depend on having solid, well-governed institutions that can respond effectively to crises and that can effectively and equitably provide public goods and services and implement policies to support sustained economic growth. Even before the pandemic, fragile and conflict-affected states had their immune systems already under strain. They were already more vulnerable to challenges such as extreme poverty, droughts, rising food prices, and in some cases, war. And the shock of the COVID pandemic has only made things worse, putting these countries at risk of falling even further behind. In general, we worry about divergence in economic fortunes. Some economies becoming more able to come through the pandemic and recover, others feeling the pressure of limitations in vaccinations, of limited fiscal space. And that divergence is even more stark when we look at fragile and conflict-affected states. They were hit hard, with real GDP per capita declining by 6.6% in 2020, and it is going to take them longer than other low-income economies for per capita incomes to recover to their pre-pandemic levels. But growth is just one part of the story. Public debt in these states increased more than in other low-income countries, up by 12.6% last year. They're also likely to face more inflation pressures too. Not only they are hardest hit, but often their needs are the greatest. Among them, displaced people, rising food insecurity, vulnerability to climate shocks. And this leaves policymakers with increasingly difficult trade-offs between elevated debt levels, rising spending needs, and difficulties bringing more revenues to meet these needs. Support from the international community is critical to help fragile states manage the crisis, to reverse the growing divergence with the rest of the world, and to encourage a resilient and inclusive recovery. At the IMF, we are committed to do our part. Since the start of COVID-19, we have provided $7.5 billion in support of fragile states. The recent $650 billion SDR allocation, and thank you, Antonio, for your advocacy for it, is also benefiting fragile states. 16.2 billion of this allocation went to support them to meet their needs. This directly boosts foreign exchange reserves that allows more help to have external stability and confidence. Some countries like Haiti are also planning to use these new SDRs to finance vital imports, and they so much need that support. We are also working to engage with our members on channeling some of the new SDRs to create a new resilience and sustainability trust to help low-income countries and vulnerable middle-income countries to achieve a sustainable and prosperous future. We are working to enhance our engagement with this important part of our membership to be there for these countries. We are developing a new strategy, articulating how the IMF's core competencies and instruments can be leveraged to help across the fragility and conflict spectrum. And we also look at capacity development to play a key role in strengthening national economic institutions, the heart of a country's immune system. Under the new strategy, we will look at how we can better customize our policy advice and also our lending to the specific manifestations of fragility and conflict. And finally, we will closely look at how we can strengthen our cooperation with other partners. Yes, we need to join forces, learn from each other, do better together in the most difficult circumstances. And this is why today's conversation is so important. We have to work hand in hand with country authorities, responded to the pandemic on the ground. So I very much appreciate the ministers of finance from Sudan and Madagascar. They have agreed to join us today. And we can hear firsthand what are their most pressing challenges, how they are tackling them, and how the international community can help. And we must take full advantage of the insights from organizations such as ICRC. Their day-to-day work puts them in contact with the most vulnerable populations. And especially in fragile states, we need all hands on deck approach to make a difference. So thank you, Peter Maurer, for agreeing to join us today. I cannot be concluding without talking about sister institutions in the development community and our United Nations family. I'm so grateful that the UN Secretary General is here with us to share his perspective. Someone who knows firsthand what it means to support most vulnerable populations. And on that note, I want to turn to Secretary General Guterres for his keynote speech.
Dear Kristalina, Excellencies, ladies and gentlemen, my thanks to the International Monetary Fund for convening today's meeting. Our world continues to face very serious challenges, from the COVID-19 pandemic to the climate crisis and growing inequality and divisions. And the pandemic has forced more than 100 million people into poverty. More than 4 billion people have little or no social support, no health care, no income protection when they so urgently need it. the Sustainable Development Goals are at a real risk of failure. And solidarity is missing in action, and the sense of injustice is spreading, creating a breeding ground for violence and conflict. People living in fragile and conflict-affected states are suffering most of all. We must fulfill the commitments we have made to change course. I welcome the International Monetary Fund's strategy for fragile and conflict-affected states. This is a critical step to applying a crisis prevention lens to the complex and multidimensional risks arising from the COVID-19 pandemic and the recovery, particularly for countries emerging from crisis and conflict. Fragility and conflict can only be addressed by macroeconomic policies that promote inclusive growth and resilience, centered on a transition to stability and the 2030 Agenda for Sustainable Development. And we need financing instruments that are tailored to the unique policy space of fragile states. The right macroeconomic policies can ensure that countries generate enough fiscal space to maintain and eventually expand social spending and to invest in prevention and peace building. Excellencies, ladies and gentlemen, vaccine inequality is a moral outrage that is condemning the world to millions more deaths and prolonging an economic slowdown that could cost trillions of dollars, hitting the poorest countries hardest of all. We need a bold collective push to end the pandemic and deliver a sustainable and inclusive global recovery. I've long been pushing for a global vaccination plan to reach everyone, everywhere, sooner rather than later. And I was pleased to join the World Health Organization last week to launch their global COVID-19 vaccination strategy. This costed, coordinated, and credible plan is designed to get vaccines into the arms of 40% of people in all countries by the end of the year and 70% by the middle of 2022. And I urge all countries to marshal behind it. In countries affected by crisis and conflict, vaccination will require targeted investment in local delivery mechanisms and capacities. This will not only guarantee that vaccines are delivered quickly and fairly, it will strengthen local and national health systems and help prevent future pandemics. Excellencies, ladies and gentlemen, forecasts indicate that we are in the middle of a substantial global economic recovery, with GDP growth ranging between 5 and nearly 6%. But these figures mask enormous divergence. Many developing countries and regions are lagging far behind. Advanced economies are investing nearly 28% of their GDPs in economic recovery, and that figure drops to only 1.8% in least developed countries, and less than 2% of a very small gross domestic product. Countries affected by conflict and crisis countries have the least fiscal space to invest in the policies they need for a sustainable, inclusive recovery, policies like renewable energy, social protection, and health care. Many of these states are also on the front lines of climate change and the brutal assault on nature, which exacerbates risks that go well beyond their immediate impacts. Unless these threats are addressed, they could fuel growing mistrust in institutions, deepening fractures, and turning back the clock on years of progress on prevention and peace building. I see 3 areas for immediate action to launch a recovery that benefits all, including the most fragile states. First, investments must be scaled up and directed into both short-term crisis relief and long-term recovery. But many countries are being crushed by debt service costs. Global public debt has soared to 100% of GDP. I reiterate my call for an expansion of liquidity for the countries in greatest need, in the first instance through a substantial reallocation of unused special drawing rights to vulnerable countries that need them. And I know Kristalina is very strongly working on that. The G20's debt service suspension initiative must be extended into next year and expanded to include middle-income countries in dire need. And the common framework for debt treatment must be operationalized. But simply suspending debt payments will not be enough in many countries. They will need effective debt relief involving both public and private creditors. We need a comprehensive strategy around reforming the international debt architecture, including debt restructuring or reduction. And private finance must be brought in to help fill the gap. It is deeply unfair that rich countries can borrow cheaply and spend their way to recovery, while low-income countries, particularly fragile ones, struggle to keep their economies afloat. No country should be forced to choose between servicing its debt and serving its people. Excellency, ladies and gentlemen, second, we must support governments, particularly in countries affected by crisis and fragility, to implement social and economic policies that build trust with their citizens and bolster resilience against future shocks, including the climate crisis. This requires significant investments to achieve universal social protection by 2030 and to prepare people for the changing world of work through lifelong learning, reskilling, and upskilling programs. The United Nations Global Accelerator on Jobs and Social Protection aims to create 400 million new jobs in the green and care economy by 2030 and to extend social protection to the 4 billion people still left unprotected. I urge you to support this important initiative. Excellencies, ladies and gentlemen. Third, to achieve the breakthrough we so urgently need, the international community must lead from the front. We must demonstrate mutual solidarity and trust by working closely together across the humanitarian development peace nexus to achieve common goals. To that end, we are ready to engage with the International Monetary Fund at the institutional level with a view to agreeing on a strategic partnership to support countries in crisis to recover from the pandemic, implement the SDGs and the Paris Agreement. There is room to strengthen our joint work in prevention and peace building, for example, by facilitating exchanging, sharing analytics, and seeking entry points to support inclusive national priorities. We can use our collaborative advantages to promote greater understanding of multidimensional risk and more strategic collaboration at the country level, and to respond to compound risks and multidimensional challenges. Now is the time for action. With greater engagement and collaboration, we can support the most fragile states affected by conflict and crisis towards a better, more peaceful and prosperous future. Thank you very much, Kristalina, and thank you to all of you.
Thank you, Antonio. Thank you for making it so clear that supporting fragile states is a moral, economic, and security imperative. And thank you for your generous offer for us to work together to bring our skills and capabilities so we can do a better job as we reach out to support these countries. I have always known you to be a strong moral voice, and of course, you have been a fantastic starter of the discussion that is now going to follow. We are going to hear from our ministers and also from Peter Maurer, and I want to engage them to help us define what is it that is top of mind and why. And I will start with Dr. Jibril, Minister Jibril. We know that Sudan was in the very early days of transitional government when COVID-19 hit, and that the pandemic exacerbated the challenges that the government was facing, and they were massive. What measures did you take to deal with the impact of the health crisis in this very complicated situation? How did you balance actions with taking care of people right now, but also thinking about building resilience for the future? How did you work with partners? How did you see us, those that are part of the international community, engage with you? What lessons do you have for us? Dr. Jibril.
Thank you very much, Kristalina. And thank you again for availing me this opportunity. And my regards to Mr. Guterres, to our sister from Madagascar, and to Mr. Peter Maurer. taking part in this panel discussion. The COVID-19 pandemic caught the world off guard, with most nations being inadequately prepared to meet the challenges of this rapidly spreading virus that affected both our health systems and our economies. Sudan certainly was not an exception and has struggled with the health and economic impact of the pandemic. The pandemic amplified and exacerbated an already difficult situation in Sudan, as we were already struggling with an economic crisis inherited from the previous regime. Initially, Sudan had low reported COVID cases. This was in large part due to the lack of data and low levels of testing. This combined with low literacy rates, low levels of awareness, the myth that COVID-19 was a disease of cold weather, our weak health system, the stigma attached to contracting COVID-19 together masks the true extent of COVID-19 infections in Sudan. The principal challenge for Sudan, like many other African countries, is the fragile and strained public health systems that face shortage of medical staff, lack of oxygen, shortage of ICU beds, ventilators, etc. This was particularly difficult in the rural areas and led many to resort to traditional medication. We are also seeing these challenges manifest in the rollout of the government vaccination program. Our weak infrastructure, I mean roads, telecoms, electricity, internet penetration, etc., also undermines our efforts to raise awareness about the COVID-19 pandemic and the current vaccination campaign we are undertaking. Here, I would like to remind you that only 40% of the Sudanese population have access to electricity, and only 32% the penetration of internet, and mainly in big cities. We also did not have a sufficient safety network to provide income during the lockdown in the first wave, and our public resources were limited, as was our payment infrastructure, and we were unable to make payments to most needy ones, that is, daily wage earners. This deepened the economic hardship faced by most Sudanese, and many dropped below poverty lines. Sudan exemplifies fragile and conflict-affected country and presents many challenges to both political and economic reforms. The priority of our transitional government is attaining lasting peace for the people of Sudan and putting the economy on the path towards growth and prosperity. As I mentioned earlier, our economy was already in crisis, and real GDP further contracted by 3.6% in 2020 compared to 2.2% in 2019. This was due in large part to the impact of the pandemic on commodity prices and trade, travel and financial flows, but also due to the legacy of economic challenges that amplified the impact of COVID-19. Despite these challenging circumstances, we realized the importance of undertaking deep economic reforms and did not shy away from our priorities and pressed hard ahead with an economic reform program that we knew would be painful for our people. We recognize that most of our economic problems emanate from years of economic mismanagement, including insufficient and untargeted subsidies. Our fiscal consolidation program is twofold and is focused on difficult but necessary measures, social spending in general, and larger health expenditure to address the COVID-19 related spending, and higher public wages to help mitigate economic impact of reforms. Second, enhancing revenue mobilization through the recently implemented customs exchange rate reforms and measures to expand the tax base. The impact of these reforms are starting to bear fruit, and we anticipate that the economy will emerge from recession or from negative development in 2021 and return to modest growth in 2022. But the social impact is still painful, and our population accommodated these pains in the hope that these reforms will bring a better future. Still much remains to be done, and this is a medium-term program to improve our financial resilience and improve development outcomes. As we continue to work with our development partners, we will hope to continue to improve our long-term reform efforts and strengthen our systems in public financial management, debt management, and economic diversification to achieve sustainable and inclusive growth and reduce poverty, while prioritizing pro-poor spending and strengthening our health systems to support those that have been impacted the most by the COVID-19 pandemic and those that have been marginalized for so many years. These are some of the measures we have taken, the difficulties we have faced, and we will come later to the lessons we have learned from this experience. Thank you, Kristalina.
Oh, thank you very much, Dr. Jibril. We are full of admiration of the bravery, especially of the young people of Sudan and the women of Sudan in taking the country in a new direction, and of the incredible dedication of the government. We have had a chance to engage and to see how strong the commitment to take the country on a new path is. And it is our privilege at the IMF to be your partner. We have achieved quite a lot in a short period of time to clear the arrears of Sudan, to get Sudan back in the international community. And on the road ahead, you describe it. It's not going to be easy. You can count on us. I also want to recognize that the Secretary General at some point may need to leave at any time. We are really grateful, Antonio, that you're with us and with us for so long. But I also know how pressing the demands on your time are. What I would like to do now is to turn to a minister who has brought a very warm heart to the job that requires also hard thinking, hard mind. Minister Rabarini, now, one step back, Rabarini Rina-Rison. I practiced this last night, Minister, but clearly I should have practiced a little more. We are talking about a country, Madagascar, that has been hit by COVID-19 at a time when the fiscal and economic conditions in the country were challenging, but with a very strong commitment from the president, from the government, to move the country forward. What we also know is that Madagascar was hit by the massive hardship from one of the worst famines in decades. You are at the wheel of steering the country through these shocks. What are the policy actions that have been most effective to support the economy? What do you think was best to help the most vulnerable people? And again, I would ask you, as I ask Dr. Jibril, what would you like to see from us, from your international partners, and specifically from the IMF?
Ok, je vous remercie de m'avoir donné la parole. Je vais m'exprimer en français. Monsieur le secrétaire général des Nations Unies, Madame la directrice générale du Fonds monétaire international, Monsieur le ministre des Finances et de la Planification économique de Soudan, Monsieur le président de la Croix-Rouge internationale, chers auditeurs et auditrices, bonsoir. Comme tous les pays du monde entier, Madagascar a été sévèrement affecté par la pandémie du coronavirus 19. Et cette crise sanitaire a eu de lourdes conséquences socio-économiques, notamment sur les facteurs de production, les chaînes de valeur et le marché de l'emploi. Le déclin des activités économiques a également engendré une forte baisse des recettes fiscales. Le taux de pression fiscale qui était à 11% en 2019 était évalué à 9,9% du PIB en 2020. Dès l'apparition des premiers cas de COVID-19 à Madagascar au mois de mars 2020, notre gouvernement avait décrété l'état d'urgence sanitaire sur tout le territoire et avait adopté diverses mesures pour limiter la propagation du virus. Parmi ces mesures, on note le contrôle des déplacements par des postes de contrôle sanitaire implantés sur l'ensemble de l'île. Nous avons fait un suivi étroit des passagers en provenance des vols extérieurs grâce à leur mise en quarantaine et surtout, nous avons fait des traçages des cas contacts tous les jours. Dès le premier cas de décès en mai 2020, les vols internationaux ont été totalement suspendus. La circulation entre les régions a été interdite. Le confinement et les gestes barrières devenaient une obligation nationale et les activités commerciales non essentielles ont dû être arrêtées. En juillet 2020, nous avons atteint le pic de 400 cas par jour sur 28 millions de population. Et le gouvernement a lancé en ces temps-là le remède traditionnel à base d'artémisia sur tout le territoire, remède appelé CVO, qui a été produit par une firme traditionnelle nationale, puis reprise par une nouvelle firme industrielle nationale. Si dans la plupart des pays du monde, seuls les malades symptomatiques ont pu recevoir un dépistage, à Madagascar, la stratégie politique était de permettre le dépistage précoce de tous les cas contacts, même asymptomatiques, et le traitement immédiat des personnes ayant eu un contact direct avec une personne infectée. Do you hear me? En raison de ce pic, les infrastructures hospitalières. En raison de ce pic, les infrastructures hospitalières et les ressources médicales ont subi de fortes pressions. Et c'est ainsi que l'État a créé à cet effet des centres de traitement spécifiques pour...
I'm not getting French. Let the French go in. I understand enough. Just let the French.
I believe she just finished.
Okay. Did she?
Yes.
Okay.
I'm very sorry.
We
got a bit of a technical problem. but I hope
Okay.
I'm now back and able to thank the minister. It is quite remarkable how we get the perspectives today that I'm sure would be complemented a lot by Peter Maurer. We know ICRC has been working directly with the most vulnerable communities. There is no place where there is fragility, conflict, and violence, but there wouldn't be a strong presence of your staff, of the staff of ICRC. What have you seen in this crisis in terms of the impact on fragility? What are the most urgent needs? What is it that you would like to zero in our attention on, Peter? And thank you for joining us.
Well, thanks a lot, Kristalina, and a very warm greetings from my side to my co-panelists. I really appreciate the IMF's FCS strategy and the efforts to join humanitarian development and other actors to respond more impactful to fragility. When you consider the impact of COVID-19 on the most vulnerable fragility conflict states globally, the multidimensionality of the current crisis clearly emerges. COVID-19 is just one amongst many stress factors in an increasingly complex fragility landscape in which the effects of increasingly protracted conflict, cycles of violence, growing displacement, changing climate intersect with a direct impact on the most vulnerable. And while the factors that we have all mentioned in our speeches now, while the factors are similar from one context to another, the priorities are very contextual. So what we need is a much more granular analysis on how to respond. And I think that's maybe where cooperation between the financial institutions and humanitarian frontliners is most in need. Amongst the 20 most fragile contexts worldwide, 17 are also most affected by the impact of climate change, and all of them are most vulnerable to COVID-19. COVID-19 has further exacerbated household vulnerability, largely due to the high food prices, income loss, and deepening poverty. ICRC's analysis, for instance, demonstrate how in situations characterized by high poverty, high dependence on markets, very high food expenditure shares, and low per capita income, the knock-off effect have significantly and disproportionately hit the most vulnerable households and communities.
Are
So
they
it's
on
the
screen?
combination of these
Are they on
factors
screen all the
which
time?
creates
Because
the
one of them is
vulnerability.
talking and laughing.
Significant reduction of coping strategy
They
as
need to
well, and
know that they are on
diminishing
screen
household
because one
purchasing
of them
power
is.
and limited government capacity to support the needs. 79% of ICRC's beneficiaries interviewed in the 24 most vulnerable context situation in which we operate by our economic security teams have reported that their livelihoods have been affected by the effects of COVID-19. Only 6.8% of ICRC's beneficiaries reported to have enough savings for protracted shocks. Amongst the most vulnerable, ICRC is particularly concerned about those people who live in areas beyond the control of governments. It is unfortunately one of the stark reality for our organization that we deal often with population, and it's more than an estimated 130 to 150 million people who live outside of government control, and they are at the top of the vulnerability scale with which we are dealing with. At the FCS macro level, there may be insufficient visibility of vulnerabilities and immediate and longer term needs of these populations, who are often effectively prevented from accessing even the most essential services. So, Kristalina, to your question, what do we need most? I think it is interesting to explore, and we may, at the end of the meeting, come to this a little bit more granularly in second interventions. We may explore the complementarities and how the macroeconomic policies of the IMF and of states can somehow support our household-directed, more individualized vulnerabilities that we are addressing as frontline organization. If I can say a last thing on COVID, I think what preoccupies us at the present moment with regard to fragility in the context of the COVID pandemic is the following. We have done a remarkable effort in increasing production of vaccines and distribution, but we haven't focused enough on the obstacles down the road and the last mile to have vaccines go to people. And I think this is the big task in the days, weeks, and months to come. If we want to really cope in an effective way with one of the most important stress factors, which is the pandemic at the present moment, we will need to look at the chain down the road, at the last mile, at distributions, at access, at vaccines resilience, but also at a broader picture of vaccinating not only against COVID, but strengthening health sectors. Strengthening health sectors clearly goes then beyond what a humanitarian organization can deliver. And therefore, we need those complementarities and partnerships with large macroeconomically and macrofinancially oriented actors like the IMF in order to have a more impactful grip on the vulnerabilities that we are talking about. So with these few words, I wanted to add this humanitarian perspective to today's discussion.
As always, very wise words, Peter. Yes, understanding in a granular way what is happening, what are the obstacles, how they can be overcome, but then also looking at the broader picture, being able to connect what is being done at the micro level with what are the broad strategic directions and policies at the macro level, us working together, which is not an easy task, but it is a paramount necessity. We have heard about the significant challenges COVID-19 is posing for fragile states. We understand how truly serious the consequences are. All of you stressed that. We looked at the very troubling projection that the global share of extreme poverty is expected to rise from 30 to 38% by 2024 for this group of countries we classify as fragile. That cannot be allowed to happen. There is a very urgent need for us to think about ways to arrest and reverse this trend. And that means boosting our collective engagement to support countries, and then, as actually all of you said, understanding what would work, where, and how to make it so that it does. We would like to now get a bit of a sense on what you have learned in terms of mobilizing resourcefulness in mitigating some of these shocks, and kind of move towards what is top of mind as an opportunity in this crisis to do better. Peter talked about strengthening health systems. What for you is that lever that can make the crisis serve a drive towards recovery, towards improvements? And this time I would like to turn to Minister Rabarini Rinarisson. What do you see from your perspective as absolutely essential so the recovery is resilient, that brings you in a better place. And knowing Madagascar's priorities, how do you see integrating the challenge of climate change, addressing climate shocks in terms of building that more resilient Madagascar?
Okay, thank you. This time I will switch on English to make it easier for all of us. So the government of Madagascar aims to transform our country into an emerging country within a few years so that no Malagasy will live in deep poverty. However, the country is still marked by weakness, which compromise the development of productive resources and which also affect our balance of payments. And Madagascar is already part of the group of vulnerable countries, but other factors further exacerbate this vulnerability. This is the case with climatic issues and natural disaster, which frequently affect economic and financial programming in Madagascar and have a strong impact on the income of the population. Due to its geographic location and topography, our country is vulnerable to external shocks and climatic issues. The country experiences a strong variation in precipitation regimes, an intensification of cyclones, floods associated with climatic disturbances, and an extension of periods of drought. As explained above earlier, the far south of the island is in the grip of an exceptional drought related to this climate change. And to address these various vulnerabilities, the Malagasy state has already initiated several measures. And among others, Madagascar has already ratified the United Nations Framework Convention on Climate Change since December 1998. The implementation of this convention has been done through our national policy of adaptation to climate change, which also materialized through which is also materialized through a national action plan against climate change. Madagascar has also, just as explained earlier, launched an emergency plan for the South, which is a program aimed to tackle the problems related to the drought in the south of the island. We also have a project funded by the UNDP called Project to Improve Adaptation and Resilience Capacity to Climate Change in Rural Communities. The objective of this project is to strengthen the capacities of vulnerable communities in the center, east, south, and southwest regions of Madagascar to cope with additional risks due to climate change. It will be a question of obtaining sustainable livelihoods in a context of climate change for the sectors who are most affected by the harmful effects of this climate change. Now, due to the COVID-19 pandemic, we had to take budget strengthening measure by setting up a national contingency funds, by subscribing to a parametric African risk capacity insurance, by inserting a special fund for COVID-19 in our financial laws. But such measures are not sufficient for a rapid and resilient recovery. To speed up the recoveries, we need some reflection to be reviewed. We first call on our technical and financial partnership to get rid of a global approach, to adapt a much more specific approach adapted to each country in order to better identify all the determining factors and especially in order to put forward the priorities of the concerned country. We also advocate an explicit call from the IMF for better coordination of the interventions of all technical and financial partners, as well as of all international investors, given the fact that the IMF is committed to promote resilient recovery for vulnerable communities. And we do not forget to call on all countries to develop a national climate plan, which serves as a national strategic framework regarding the economic and financial dimensions on change climate. And for vulnerable countries like Madagascar, we must strengthen the basis of a common position with regard to the Paris agreements relating to the commitment of developed countries to provide fundings to up to $500 billion over 2020 and 2024, which means 100 billion USD a year. Finally, the development of innovative financial initiative is strongly requested to support fragile countries. So we think these are the measures needed to accelerate resilient recovery in part to face multiple challenges for Madagascar. Thank you for listening.
Thank you very much, Minister. And I recognize that we had a technical glitch when you spoke in French. We might have cut a bit short your presentation. If there is anything you want to add to what you have been saying at that time, please do so. And my apologies for that. And many thanks for your agility switching from French to English for us.
Okay, so I'll be move back to the previous question then. As I said, we had a peak of the pandemic on July 2020, and as a result of this peak, hospital infrastructure and medical resources came under severe pressure. And this is how the state, this is why the state created a specific treatment center for COVID-19 for this purpose, especially in the cities most affected cities, to accommodate patients with severe symptoms. Patients were treated there with the financial support of the government. And those centers and some hospitals were provided by the state with new equipment such as oxygen cylinders and concentrators. A national COVID medical management platform has also been set up to manage the logistic of patient treatment. This platform had a call center which enabled patients to know from a distance where can they find a free center to be treated. And the platform also organized the daily provision of oxygen to the most needy centers. In addition to that, social protection programs have been strengthened through social safety nets. We called them Tuskia Famenu and Fatsitsinzo to support vulnerable households and improve the livelihoods of workers, especially in the informal sector. This included cash transfers and free delivery of basic necessity to the most vulnerable peoples. 2,500,000 people were able to benefit from these social programs during COVID-19. Fiscal and financial measures have also been taken to support vulnerable small and medium enterprise. We let them postpone the deadlines for the tax declaration. The granting of loans at a low interest rates by banking services. And the government had also lifted the state of emergency in October 2020, when the numbers of cases have decreased significantly. At that time, we had less than 10 cases per day throughout the territory. Containment measures and reunification were eased but the closure of international flights was maintained. However, around January 2021 or February 2021, Madagascar was not spared the second wave of the deadliest new variant of the virus. The different kind of measures were then taken up again, including the announcement of the state of emergency, the ban of public and private meetings, isolation of the region, of the most infected region in the country. Facing this second wave of the pandemic, the population was given the choice to be vaccinated or to continue with the traditional remedy that we call the CVO. And Madagascar has also joined the COVAX initiative with the support of the World Bank and other partners, an initiative which has enabled the start of the vaccination campaign throughout the country. So far, we have received nearly 775 doses of vaccines. What else? The technical and financial partners have also give us a hand to deal with the health crisis. And as such, in 2020, we received emergency financial support from the IMF through rapid credit facilities for a total amount of $337 million. And these facilities made it possible to fill the revenue gaps in the general budget for 2020. And on March 29, 2021, the IMF's board of directors also approved a new 40-month extended credit facility agreement in the amount of $312 million to support the reforms needed to the country's economic recovery after COVID-19. The World Bank has also disbursed emergency budget support of $78 million and $100 million for vaccines. And thanks to all of these efforts, the cases of COVID have decreased markedly in Madagascar at this time. The state of emergency has once again been lifted, regrouping and meetings have resumed. Treatment centers, specific centers have closed. The National Medical Management Platform is no longer publicly installed, and economic activities are starting to pick up again. In short, so far, since the start of the pandemic in March 2020, we have a total of 33,060 people infected by the virus, which is 0.15% of all the population. I don't know if we still have time for the specific challenges encountered in the South, or
We unfortunately, due to this technical glitch, I'm worried that we are running very close to the end of the meeting. Okay. If you have one sentence point you want to make, please do. And then I would turn to Dr. Jibril and to Peter.
Maybe just for the South, I just want to point out that the South is gradually transforming under the leadership of the President of the Republic and the entire government, who are very committed to fight this famine in the South. So we believe that Madagascar is on the right track, the right path, a path that will take time, but a path that will certainly be done. Thank you.
Count on us. You can count on us to be with you on that path. In this limited time we have to wrap up our meeting, I want to ask Dr. Jibril, if you were to have a magic wand and make it so that the international community comes to help Sudan in the most effective manner, what would you want from us? How can we best support the big reform efforts that you are undertaking? What can we do for you?
Thank you very much, Kristalina, and I promise to be short this time. This experience of COVID-19 pandemic actually proved to us that we have to have a few things if we wanted to respond adequately to such calamities. Number one, we think the world have to act collectively and share information, because actually the level of information available to some countries are not the same about the same pandemic. That's why the degree of response was different. And if we can share information, that will help us act promptly and timely and reduce casualties. That's one. And this works with regional calamities as well. For example, locusts, floods, whatever. Unless we share information, we don't know how to act. Number two, we need to learn and exchange again experiences from all over the world, because some have better experience in responding to calamities than others. And we need the technical training, helping people to respond, to predict and respond to calamities as effectively as possible. Number three, I think institutional capacity is the most important thing. You know, in Sudan, we wanted to reach people at some point, even if we have money at hand, we do not know who is the right person to receive this money, because we don't have the database and we don't have the telecom system or banking infrastructure that help us reach the people. For example, for the program where the international community came together to support Sudan in family support program, we have had difficulties reaching to the poor people. So we need to build this institutional capacity so that next time we can reach people faster. That's very important. In all cases, unless you have the economic strength to reach, to put some money in times of calamity, and you have enough reserves, you can't actually respond, even if you know how to respond to this. So while the rich countries could keep people at home and still spend on them in a proper way, we failed to do that. And as a result, many dropped out below poverty lines. So I think to build economic strength, which means to build infrastructure, to have developmental resources for growth, all that is very important. And this is where international assistance is very important. For example, the SDRs, extra SDRs, availed by IMF of late is of great help and lifeline for, I think, the FCS, all of them. And for example, in Sudan, we received, or we are about to receive assistance from the IDA and the African Development Bank. These are now helping us restructure our economy and put it in the right track. So I think the international cooperation is very important to face calamities in general, pandemics in particular, and we need to understand that the world is now a small village. If we cough here in Sudan, I am afraid you are going to sneeze in New York or DC. So we need to work together. Thank you very much.
Fantastic. Thank you very much. So we need quality information, capacity, to reach people, the financial resources to do so, and do it together. I cannot agree with you more that we do live in one small village. We are so interdependent, and I know that Peter is going to touch on this. How can we be more effective working together? You touch on this point, Peter. So tell us, you have an impressive field presence, you work in a very challenging context. How can we be an integral support system for Dr. Jibril as he is wrestling with the challenges in front of him?
Well, thanks again, Kristalina. As we are coming to an end, let me just be very crisp and almost telegram style. I think first we need to recognize the problem. Systemic interventions cannot afford siloed approaches. I think we have learned over the last years that we need more fluid interaction between humanitarian, development, economic, social actor, peace actors. Secondly, if the big task that we have in common is building more resilient social systems, we have to first stop the degradation of those systems in particularly fragile contexts. We have to stabilize highly unstable contexts in which we operate, and then we have to slowly and circularly build up social systems. Thirdly, if we want to do that, we need, in particular, to look at developing more tailored and flexible instruments. One size does not fit all in highly fragile contexts, and this is, of course, a big task for big organizations. Fourthly, I would strongly recommend that all of us turn to a more adaptive interpretation of our respective mandates. Being faithful to mandates is important, but not being dogmatic about mandates is also important. We need to adapt our mandates to the reality of people. We have to listen to people, what they need, and be able to interpret our mandate without going into complex and protracted changes of mandates. We have to interpret it in a way so that we better service people. Fifthly, we have to maximize complementarities and to build value chains specifically for fragile countries and contexts. And when I say value chains, it's really to understand how we align our respective tools and instruments in order to produce impact. How do we do that? I agree with Dr. Jibril. Sharing knowledge and comparing notes in the field is the good start to do. We have to start there, having better knowledge in working together. And then, very frankly, if trust and confidence build amongst institutions, we have also to address taboo issues, corruption, war economies, and intricacies with which we are dealing with. And finally, I really would recommend that we choose a couple of selected places in which we can have and build experiences. Sudan is a good example. The Sahel, the Lake Chad, and the Horn of Africa would be good examples in our view, where the IMF, the World Bank, the UN, humanitarian organization like the Red Cross and Red Crescent movement can build learning processes of complementarity, of knowledge sharing, of impact and resilience building of social system, which is so critical. And the pandemic has just learned us that if we don't do it, we will look into much more drastic and much more difficult situation. Sorry to be very short, but I think it needed to be short given the advanced hour of the day, but I appreciate having been invited and having been able to share this panel with all of you. Thanks a lot.
Thank you very much, Peter. Actually, you have done a great job to take us to summing up our discussion. What we heard from you is what I think penetrated through the interventions so far. We do need to recognize that one side doesn't fit all, that mandates should be enablers, not disablers of collective action, that learning from each other is the only way for us to succeed in very difficult circumstances, and that we have to have the humbleness to recognize the universe of fragile states has been expanding. And unless we commit to bring all our forces together, we will not arrest and reverse that trend. I take to heart your call, identify concrete places, concrete issues, work together, and make that working together the driver for better days to come. From the bottom of my heart, I want to thank you for your contributions today. I wish you all the success to our ministers wrestling with the challenges ahead of you. To Peter, to build that camaraderie you are advocating for. And let's make sure that fragile countries are high on our agenda. Thank you very much to all our viewers, and have a very good day or evening, depending where you are.
Thank you.
Thank you.
Thank you.